Hello, good evening, and welcome to Citizens Hospitals and this very special interaction with Dr. Sudhir Poganti. He is an interventional cardiologist at Citizens Hospitals, Hyderabad, and he's completed his MBBS from Armed Forces Medical College, Pune, and he's practiced and trained in the United Kingdom as well. Today, Dr. Sudhir joins us to speak to us about managing cardiovascular diseases and cardiac emergencies during the COVID-19 pandemic. Sir, thank you so much for joining us this evening, and we are delighted that you could take time from your busy schedule to answer some of our questions.
My pleasure, Venus, and I'm delighted to do this session on behalf of Citizens Hospital. So thank you for having me.
Right. Sir, as we will be discussing about cardiovascular conditions and emergencies during COVID times, why don't we first lay out the landscape for what is this coronavirus pandemic that has captured the thinking and imagination of the world right now?
Yeah, as you all know, we're in the middle of this coronavirus or COVID-19 pandemic at the moment. The disease has originated from China in Wuhan, what is presumed to be from Wuhan sea market or a wet market in the middle of December, and has since rapidly spread across the world. Now, this novel coronavirus, as the name suggests, is a novel virus, presumed to have mutated from its predecessor called the SARS virus, which was an epidemic in itself in 2007, and has since infected lots and lots of people. Now, the predominant mode of infection or mode of entry seems to be aerosol spread because of aerosols, and the point of entry is usually a nose or eye, or sometimes if there is if you touch a surface which has got virus and then touch your face with the hand, then there is a very high risk of transmitting this virus to yourself through nose and through eyes. That is why it's paramount that one should not touch their face frequently with the hands. And then coming to the nature of the disease itself, it causes severe respiratory illness, which can be life-threatening in a minority of people. But in over 80% of the people, this is a self-limiting illness with mild to no symptoms. However, 15% can become really sick, requiring ICU care. Out of them, again, a small percentage will need ventilation and may even need ECMO support, the extracorporeal membrane oxygen support. And a small minority may actually die. Various studies and reports have shown the fatality rate to be between 3 to 5%. Now, who are at risk of death or severe illness from COVID? Again, studies have shown a few characteristics to be independent predictors of death. Older people, those who are aged greater than 65 years, female sex, those with background history of cardiac problems, those with background history of chronic lung problems because of smoking, and also current smokers. These are the people who tend to do badly once they get the disease. And currently, what do we have in terms of treatment? Various drugs have been tried, but none of them or have built enough evidence to say that this conclusively helps. We've tried hydroxychloroquine in cases that turned out to be positive, or in people who got exposed to people carrying the disease, and also in healthcare workers. But so far, the studies did not show any robust evidence behind the routine use of this drug. And there are some drugs which we use infection, and they have shown some promise, but again, the studies are ongoing and we just have to wait out. And unfortunately, vaccine is still at least a year away from availability, and for now, all we have to do is, take precautions so that one does not get this virus by practicing social distance, staying at home, washing the hands regularly, and using a face mask when they go out. Yeah, that is novel coronavirus or COVID in a nutshell.
Right. So now coming to specifically the topic of our discussion today, which is cardiac emergencies and cardiovascular diseases. So even before COVID, I mean, this is not something which can be taken lightly. So first, if we can lay the ground for helping our viewers understand what are cardiac emergencies and cardiac conditions which require immediate medical attention.
Yeah, that's a great question. Even before this pandemic, cardiovascular emergencies are some of the emergencies which we have to offer treatment in a timely fashion to ensure the patient gets good outcomes. And the first and foremost is heart attack, what we technically call as acute myocardial infarction. When somebody is having a heart attack, the priority is to save the heart muscle. We call it thymus muscle. So the more the delay in offering the treatment, the damage that is going to occur to the heart muscle is increases exponentially, and therefore we have to offer the guideline-directed management, which is what we call primary PCI service or immediate angioplasty straight away. So that's the first and foremost. Followed by that, we have other emergencies such as cardiac arrhythmias, which is irregularity in the heartbeats. Again, some of them need emergency treatment. And then acute heart failure, by which I mean people who are having a weak heart muscle, developing a rapid buildup of fluid in the body and in the lungs, and they have difficulty in breathing. People with brain strokes, even for them, the treatment is interventional these days to ensure they get good outcomes. And there are other conditions such as clots in the lungs and so on. So these are the main emergencies which we have to deal with in a timely fashion to ensure a patient gets good outcome.
Right. And sir, I think predominantly a lot of people face a challenge in terms of identifying what is a cardiac emergency. I think that is where people also lose time. So if you can help our viewers understand what and how do you identify a cardiac emergency?
Yeah, let's take again one by one. Let's talk about heart attack. I'll just share a leaflet which shows what are the symptoms of heart attack on this slide. So essentially, heart attack is a condition which one develops because of blockage in a heart artery. As a result, the heart muscle is not getting enough blood, and then patient experiences symptoms. Next one. Yeah, this is the leaflet which I want to share. This is the one in Telugu, and I will also share one in Hindi, English. Sorry. As you can clearly see, the symptoms experienced by females and males are different. Males tend to typically describe chest pain or tightness across the center of the chest associated with sweating, nausea, or vomiting. Whereas females, the symptoms need to be tend to be slightly atypical. Therefore, we need to have our index of suspicion a little higher so that we don't miss this important group of patients. So they tend to experience jaw pain, breathlessness more, and fatigue and nausea, or the feeling of as if they're going to vomit. And sometimes their pain may not be typically located in the center of the chest. It can be on the back of the chest as well. So that is heart attack. And heart failure, one would straight away notice extreme breathlessness. They are unable to get enough breath, along with swelling in the legs, or perhaps sometimes the whole body. And then coming to the stroke or the brain stroke, there is a mnemonic which we use called FAST, which is essentially based on the symptoms they experience, which is loss of speech, loss of they notice the facial droop and weakness in one of the arms or the legs. If they notice any of these symptoms, they need to report to the hospital immediately so that we can offer the advanced treatment so that they recover the function, the speech, or the weakness in the limb or the arm fully.
Right. So now, if you want to just go a little further, in terms of misidentifying or missing identifying, sometimes people misidentify certain symptoms as cardiac emergencies, and if they happen enough number of times, when the actual cardiac emergency happens, then they tend to misidentifying it altogether. So if you can throw some light on this particular situation.
I mean, this is a very important scenario which everybody needs to be aware of. And it happened a lot in the last month or two during the lockdown period. Mm-hmm. Essentially, what happens is there's a bit of an overlap between the symptoms of the cardiac emergencies and the COVID, which is the common one which we talk about is the breathlessness.
Correct.
Now, due to the lockdown, generally across the world, the incidence of the heart attack seems to have decreased a bit. Mm-hmm. Now, there are good reasons for that. One is less stressful life, staying at home might have helped to an extent. But equally, some people have ignored the symptoms and primarily because they are worried about getting to the hospital and worried about getting infected with coronavirus. Mm-hmm. So people would have had mild chest pain and they would have ignored it for a day or two. By then, the heart attack is complete, leading to extensive damage of the heart muscle, leading to breathlessness. Then they don't know what this breathlessness is due to. Is it COVID or is it something else? Right. Then the situation gets muddled. But either way, when they present so late, the chance of getting a good outcome by doing any sort of intervention is less.
Right, right. Sir, if you were to reverse the scenario, now what here we are talking about is that cardiac emergency developing or rather worsening to mimic a COVID emergency, but is it possible that a patient who is infected with the coronavirus can over a period of time worsen his or her cardiac condition as well?
Yeah, very much so. Yeah. So there are 2 or 3 scenarios which everybody need to bear in mind. So people with no COVID can get heart attack. So my advice to them is they got to report to the hospital immediately. I think there is a bit of a misconception that hospitals are closed or hospitals are not taking patients. That is not the case. We're fully geared up here at Citizens Hospital to provide cardiac emergency services around the corner, 24/7, 7 days a week, 365 days a year. We are taking due precautions in screening the people to ensure they are safe, they're not at risk of getting COVID. And we are also taking care by using PPE or what we call protection equipment, using specialized masks and kits to ensure the risk of infection is minimal for all the parties involved. The second thing is, person who is COVID can get heart attack. This is due to various reasons. COVID itself is an infection, and it sets off what we call a massive inflammatory response within the body. And if anybody has got a block in the heart artery, that can technically what we call a plaque rupture, blood clot, leading to a full-blown heart attack. Then there is a third scenario wherein person with a COVID-19 infection can have symptoms and ECG findings that pretty much masquerade as a heart attack, but in actual fact, it's not heart attack. It is what we call extensive inflammation of the heart muscle. Again, for that, they need specialist care, but not immediate angiogram or intervention, but a specialist care, specialist critical care, and supportive management to ensure they get good outcomes.
A person is affected with the coronavirus. Does it make it more difficult for you to deal with their cardiovascular emergencies, or is it just the same as a normal patient?
No, it doesn't. It's same as a normal patient, because at the moment we're presuming any patient who comes to the hospital door is a COVID suspect. Therefore, we ensure they're isolated. We ensure we are safe by taking adequate precautions with this PPE kits, and give the timely and guideline-directed management to ensure they get good outcomes.
And during this COVID times, existing heart patients, are they at a greater risk as compared to normal patients, or would their risk propensity to be affected with coronavirus stay just the same as the others?
Yeah, great question. Unfortunately, they are at increased risk of, not at increased risk of infection, but increased risk of getting bad outcomes. Again, I'll share this leaflet, which will throw some light on. Srinivas, can you share this? Srinivas, can you share the leaflet? The poster, next poster. Yeah. What you need to bear in mind is that what the studies have shown, people with extensive comorbidities, predominantly cardiac, tend to do badly when they get coronary infection. By that I mean those who've got diabetes, those who've got blood pressure, and those who got prior history of coronary artery disease or heart attacks, those who've got heart failure, and even people who have had a cardiac transplant, for that matter. So these are the people who need to be extremely careful. They're not per se at increased risk of getting COVID infection, but they tend to do badly once they get the infection.
Sure. And are there any additional precautions that you will suggest people with heart conditions in these COVID times?
Yeah, I mean, they have to generally follow all the general precautions which we've been alluding to, the social distancing, washing hands frequently, using face masks when they go out, and all those. In addition to that, because people are staying at home, a lot of people do not have access to the routine exercise, where they're going to gym or to work. So people tend to put on weight, and that may lead to getting their diabetes and blood pressure control, out of hands. So it's very important that we keep active within the house. Again, I have some very useful poster to show how you can keep active in the house. Srinivas, can you share that poster? Srinivas, share the poster, please. Yeah, this is a very handy leaflet which you can use to remain active within the house during the lockdown period. And then one need to watch out their diet, what they're eating. They need to strictly adhere to the low salt diet and the low sugary diet to ensure the diabetes and the blood pressure remains under control. And foremost, or last but not the least, is taking the medications regularly. And one of the main ones is blood pressure medications. There has been a lot of press recently stating that some of the blood pressure medications that are commonly used, called AC inhibitors or angiotensin receptor blockers, are not good. But that fear is unfounded, and in fact, these drugs control the blood pressure really well, and also they are widely used in people with bad heart failures. So by omitting these drugs, there is a chance that people's blood pressure can get out of control, and their heart failure can become worse rapidly, leading to bad outcomes. Now, again, I have a list of drugs which I will share later on the Facebook page, and the common brand names which I'm talking to. But the ones which we commonly talk about is Ramipril, Telmisartan. Those kind of drugs are not to be stopped and to be used routinely. And the other thing is, if there is any doubt about any of these medications or about any cardiac-related condition, provided the patient is stable at home with no emergencies such as ongoing chest pain or severe breathlessness, try not to come to the hospital for any routine appointment. All those advices we can safely give through online consultation. Again, Citizens Hospital has set up a portal through which you can have an online consultation, and we can discuss everything face to face, and all the necessary advice can be given. Yeah.
Right. I think you just alluded to that aspect in the last few lines. The fact that due to the lockdown, a lot of patients not being able to get on with their regular checkups, whether it is for cardiac or for diabetes and so on. So, does this also impact their health and overall risk of developing cardiac conditions?
No, I don't think so. Not seeing a cardiologist is not going to increase their risk of having any cardiac events. What is going to help them is routine cardiac appointment can be done through online consultation or virtual clinic. These are the times for virtual health clinics. Unnecessarily coming out and getting exposed and running the risk of COVID infection is unwarranted.
Right.
However, if they have any worrying symptoms, again, that can be picked up during the online consultation, then the cardiologist obviously will ask them to report to the hospital so that they can carry out a few checks to ensure everything is okay.
Right. Sir, slightly away from the COVID scenario, over the past couple of decades, what we've seen is the age profile of cardiac patients has gradually shifted towards the lower end of the spectrum, with most of the cases coming from the urban and IT kind of crowd in large metro cities. And now this very crowd has shifted to home offices and virtual offices, and the hours seems to have increased for their work and so on. So how does this pan out for the cardiac health? Does it do they become more prone to cardiac conditions, or should they be more careful about how they manage their work and home and stress in the days to come?
Yeah, I mean, great question. But I have a contrary view on this. Paradoxically, more recently or since the lockdown period, we haven't seen that many young patients coming with heart attacks.
Okay.
So I think work from home, probably in touch with the family all the time, might have actually eased the stress. And perhaps reduced the incidence of heart attacks. And one other thing is, I know it's too short in a period to see long-term benefit. People are eating home-cooked food, which is generally healthy. And when they're at home, smoking is probably not possible because with the family around, I'm sure smoking, the family are not going to allow one to smoke. I think all these things are actually helping them.
Right.
But equally, like you said, a lot of the gated communities are not allowing people to walk in the mornings because there's strict rules from the police to not let anyone out of their houses, so which makes people generally sedentary. They put on weight, which is not good in the long run. So, which is again is a reason why they can use my poster to ensure they remain active within the house and healthy.
Right. So, a final question. Overall, I think it's important that all of us take care of our heart and heart health. So, in the days to come, as we slowly move towards a post-COVID world, what should be the primary modes of us taking care of our heart and our heart conditions, whether or not we currently suffer from any heart condition?
Look, post-lockdown period. Things are going to actually get even more difficult. At the moment we are sticking to our houses and our workplaces like hospitals. We're not getting exposed to a lot of people, so actually the risk of infection is very low. But post-lockdown, things are not going to be same. When you go out to buy groceries or anything, you're going to get mingled with a lot of people. So it's paramount, even more important, that we practice social distancing, use face masks, use sanitizers, and wash the hands regularly to ensure we don't get the infection. Apart from that, everything else which we were practicing pre-COVID in terms of maintaining a good cardiovascular health remains the same. Adequate exercise, good dietary pattern. If there is a background history of cardiac disease already, ensuring that you take medications regularly, and so on. All those one has to continue as usual, along with these important steps to ensure one does not get infected.
Right, sir. I think that covers the entire spectrum of cardiovascular emergencies as well as COVID scenarios and post-COVID. Thank you so much, sir, for your time and for patience in answering all my queries. I hope you come back sometime soon on this program.
So my pleasure. I just want to finish with one point. Stay safe, stay at home, but please bear in mind, we are here to take care of you. If you got any cardiac emergency, we are here round the clock, 24/7. So please do not hesitate to call us.
Right. So thank you so much. Thank you to the audience for being part of this. Do visit our website as well as our Facebook page for more updates on your health and availability of doctors and consultation from all of us here at Citizens Hospitals. Until next time, it's thank you and goodbye.